So CHWs are specialized public health professionals. So we are going to look at how CHWs are specialized public health professionals. But before we really start talking about the CHW role, we first need to define public health as a profession. And one of the things I always like start off with when we look at the word public health, it has two words in it. It's public and health. And then those words come together to create public health. And each word individually means something unique. So when we talk about public health, we are talking about the shared spaces between people, the interactions between people, right? So any space that is common, any space that is not owned by anyone, we consider that a public space, like a park, the beaches, sidewalks, streets, etc. All those spaces are public. People's actions, right? When people do certain actions and behaviors, sometimes those actions and behaviors only affects them. But the minute that those actions begin to impact other people, that becomes a public issue. For example, secondhand smoke. People who are smoking, they're impacting themselves, and it's their right to go ahead and smoke, even though they know that smoking has a strong association to lung cancer. It's their right to do that. But the minute that their smoking begins to impact other people, i.e., cause secondhand smoke, it's now a public problem. So when we talk about public, it's about any type of action that is impacting other people. It's about any space that we share in common with one another that no one owns. Then the other aspect is health. And health is really just looking at the conditions in which people are able to thrive. Health is subjective. Everyone has different health outcomes. And health should be something that is holistic, meaning that it should be focused on both the body, mind, and spirit when we are trying to achieve certain outcomes. So then we put those two words together and we get public health. And public health is the art and science dealing with the protection and improvement of community health by organized community effort, and including preventive medicine and sanitary and social sciences. It focuses on populations rather than individuals and aims to improve community health through prevention, education, and health promotion. And then the definition of public health, we have those two words, art and science. And you may ask, how is public health both art and science? Like, you may understand the science piece, right? Because public health utilizes evidence, right? Data in order to create change, in order to inform their decisions. So public health is focused on evidence, or utilizes evidence-based practices is what we call it. Evidence-based practices is refers to when you use data in order to drive your actions. And so public health relies heavily on epidemiology, biostatistics, and research to develop effective health interventions. And for public health, epidemiology is our primary science core, right? It's our core. Epidemiology is really what makes public health a science and not just an art. That's what creates the science. And we'll get into this terminology of all these other terms later on. And then also public health is an art. And when you think about art, what do you think about? What does it think about whenever you think about art? Most people think about someone drawing something, being creative, like a creative expression of something. And you're absolutely right if that's what you think art is. And public health, that's exactly what public health does. Public health, um, it has to be creative and coming up with solutions, right? What is the whole purpose of knowing all of this science stuff, all this evidence, if we can't relate it to the people? So public health needs to be able to relate that information to the people. So public health requires communication, cultural competence, community engagement, and advocacy to translate science into real world impact. And the art of public health are those prevention and intervention strategies. And when we think about CHWs and how CHWs apply public health as an art and a science, CHWs are a specialized public health profession. And what they do is they actually blend both the science and the art of public health to promote health, prevent disease, and reduce disparities in their communities. They apply evidence-based practices while using relationship building and cultural competencies, the art piece, to ensure prevention and intervention strategies are effective and accessible. And a lot of people are like, well, isn't public health like medicine? Aren't they like the same thing? Well, I like to say that doctors practice public health one patient at a time. And then when we throw CHWs into that equation, CHWs practice public health by reaching entire communities one relationship at a time. So when we look at the comparison, medicine really focuses on individuals, right? They really focus on individual patients. Public health is focused on the population, and CHWs is focusing on how do we connect individuals or even communities to healthcare and community resources. To understand the relationship of medicine and public health, we have to understand how data flows in the United States. It goes from the local, state to the federal. And then the federal utilizes data to get the snapshot of the entire nation. The state utilizes that data to get a snapshot at the state level, and the local utilize the data to get a snapshot of their community. And so public health, all that data that the doctors collect, right? Every time a patient comes in, they're collecting data from that patient. The public health professionals are looking at that and like, look at all these people who are getting sick from something. There must be something going on in that community. So public health is really looking at that data in order to um, find where problems are or hotspots. And then so medicine is focused on one patient, public health focuses on the community, and CHWs focus both on the individual and the community level. When we think about assessment, the medical field utilizes symptoms, right? Someone comes in, they're checking the symptoms, and like based on these symptoms, this is what you have. Public health people are more so surveilling disease patterns or trends. So while the doctors are collecting all that data, public health is like, oh, look at all these people getting sick with this one disease over here. We need to go see if there's a problem over here. Do we have to do some prevention or intervention strategies? And CHWs are ones who may even collect the data themselves as well to identify barriers to health. When we think about the data process and how health data and research goes, there is a biomedical science field, which actually cuts across all fields because biomedical science people are the ones who are like in the lab creating like the vaccines or looking at the different pathogens under microscopes, etc. So that's important to both medicine and public health. Public health is really focused on the epidemiology, statistics, and behavioral sciences to prevent health problems, which medicine also utilizes those as well, right? Because all the data is shared out. But those are core disciplines of public health specifically. And CHW utilizes all that data to advocate for health programs and policy change. And then when we think about treatment, doctors rely on individualized treatment plans, right? Providing medications. If someone needs to go to rehab or surgery or something like that, doctors provide that solution. But for public health, the solution or the treatment approach is more so trying to create policies, create intervention and prevention programs. And then CHWs, when we think about how CHWs treat people, because CHWs do not diagnose, and they do not do direct treatment. But if we think about treatment, helping people get better, CHWs does do health education. They refer people out, and also they offer supportive services. And even though public health is very valuable, and it has shown to have a lot of cost benefit, because if you prevent people from ever needing to go to the hospital, then we are able to reduce the cost of healthcare. The United States does not spend much on public health at all. About 3% or less of the nation's budget actually is spent on public health, while 97% is spent on medicine when we think about the health spending. And CHWs has actually also shown, right, because they're part of the public health profession, that they actually lower costs and they have high impact health solutions that also are cost benefit and reduces the need for people to go back to the hospital or have lengthy hospital stays. And when you think about the goals of medicine and public health, medicine is more focused on reactionary care, meaning that it reacts to something, right? A patient comes into the doctor, and by coming into the doctor, then they have symptoms, and then they go to the doctor, so they're reacting to these symptoms. The doctor's in their office waiting for someone to come in. They go in, they see the doctor, and so the doctor reacting. Public health takes a more proactive approach, and so public health is not waiting for people to come to them. They actually go out in the field to help prevent diseases and educate people, etc. So they try to be proactive, and they try to keep people healthy, so that they never need to go to the doctor. And then CHW focuses on empowering individuals and communities to improve health. And then we think about the government role. Um, Medicine is regulated by state and federal healthcare laws, as well as local as well, but more so state and federal. And then when it comes to public health, it's primarily state led, but guided by federal public health policies. And then CHWs tend to be funded by state and local programs. So they're governed by state and local programs, etc. And so public health does have core functions.